I'm Jacqueline Louwers, and I specialize in pre-malignant lesions and colposcopy as a gynecologist. And I work in a large regional hospital in Utrecht, where we also take responsibility in training young doctors and residents in the art of colposcopy. Well, I think mainly because we're not as good as we think we are. So we've proven in several studies, me and other researchers, that the sensitivity of the colposcopic examination is maybe average. And that's where the color-coded map of DYSIS steps in, because then you can really increase your sensitivity in the detection of high-grade lesions and make it much better. And with the higher sensitivity, you're picking up lesions much sooner, and you can give women the right treatment sooner. So I think that's the greatest benefit of using DYSIS. Well, the major benefit is that you increase your sensitivity, and it's easier for you to detect high-grade lesions. And it's easier to detect high-grade lesions because the color-coded map gives you an impression of the acetylwhitening effect, but therefore it also helps you in localization of the optimal biopsy site. So it points out to you where you should take your biopsy, which is the most abnormal site of the cervix. It also works the other way around. If you do not see anything and DYSIS doesn't see anything, then it's also safe to refer people back for follow-up or to the population-based screening, because you have this extra check that nothing is going on there. Well, I think the detection mode is the best feature of the DYSIS. It gives you a color-coded map, and that's an overlay over the cervix, and the different colors correspond with the different lesions. So the blue color means nothing going on there, up to red, yellow, orange, which tells you there's a high-grade lesion. And that really helps you to decide, should I do see and treat procedure, or where should I take my biopsy from? Yeah, DYSIS improved my examinations in two ways. First, by helping me detect the lesions and the biopsy sites. So I'm more correct in identifying which patients need treatment and which ones do not. And on the other hand, it helps me to safely refer patients back to the population-based screening or follow-up, just as I make sure that I'm not missing anything. Yes, absolutely. And that's because we know from a very nice study from Beckers et al. That even if you're very experienced in colposcopy, that doesn't mean you have a higher sensitivity in the colposcopic examination. You just need less biopsies to come to the same conclusion as maybe the nurse practitioner. But your sensitivity of examination is the same. And we're not using old telephones anymore. We all have a smartphone. So if the technology is there, why not let you help you by technology to improve the examination, to improve your colposcopy? Well, the patient benefits because they're getting the correct treatment sooner. And that's because it's easier for you to detect the lesion, it's easier for you to detect the optimal biopsy site, and on the other hand, it's also easier for you to refer patients back to the population-based screening, and maybe also without taking a biopsy. If it's a low-risk patient, you do not need biopsies if the DYSIS is negative as well. Well, I started working with DYSIS already in 2006 because I was one of the investigators on the DYSIS validation trial. And since then, on and off, I've kept on working with DYSIS. And at this moment, we're very lucky to have a DYSIS Ultra in our hospital. But I've always been a fan of DYSIS. So I think it's a great added value to your colposcopy clinic. I think the three main reasons are, first of all, that DYSIS has a higher sensitivity and is very objective. It has a steadily higher sensitivity through all referral groups. We also see that your high-grade yield of the biopsies are better. So if you take a biopsy, the chance that you're taking it from the right location is higher. And thirdly, I think it's great for teaching purposes because you can review the examination, you can see what they have done, and you can also be in the room and see what the resident is doing. So I would say those are the three main reasons. As well, there is of course a learning curve because it's a slightly different technique. First of all, you need to attach the speculum to the colposcope, and that's just something you need to do a couple of times before you can get really handy at that. And then of course you need to change the way you look at the cervix. Most regular colposcopes use binoculars and you have the direct view of the cervix, while DYSIS you're using the video screen. And that is a different technique of looking at a cervix and interpreting the images. I think that will take most time to learn, and you need to develop some trust in a color-coded map. And of course it's good to be skeptical at the beginning and maybe double check. And I think it will take you up to 20-30 colposcopies before you can really say, okay, now I know what I'm doing and how to use DYSIS. Well, not often, but I do sometimes, and then I just take a biopsy, or I say, okay, I'm not taking a biopsy. But I trust the data on DYSIS, which is very consistently that it's better than we as colposcopists. But there are always situations that DYSIS has difficulties as well. If the patient is very obese and part of the cervix is blocked, then he cannot give you a color-coded map over the blocked part of the cervix, of course, and you need to give your own interpretation. Or if you have a very nervous patient who moves a lot, then it can be difficult for DYSIS to give you the color-coded map. So this machine has no brain, you have to use your own, and it's always a combination between doctor and machine.